Senator Carper.
Before we adjourn, I want to touch on workforce one more time, if I may.
Certainly.
If I could. I asked my staff if this question has been asked already, and was told that it has not, so I want to go ahead and ask it. Well, we have a major healthcare provider in our city. It's called Christiana Care, and it's huge for a little state. And we have any number of smaller hospitals and federally qualified community health centers. I stay in close touch with almost all of them, my staff does. And one of the things I recently discussed with the people who run Christiana Healthcare, large facility, large healthcare provider, what among their challenges, workforce. And it's not just the federally qualified community health centers. It's just about everybody. And we find that almost every employer that we talk to, I do a lot of customer calls with businesses, large and small, throughout my state, and we hear this all the time. And let me just, if I can, Dr. Holmes, based on your research background, could you just give me some idea of which ways in which expanding provider training at rural health facilities have demonstrated success in increasing the rural health workforce? Again, I like to say, find what works, do more of that. Just give us some examples of that.
Yeah, sure. Thank you for the question. So I think the first one I'll come up with is the Rural Residency Planning and Development Program, which was rolled out by HRSA, I think, 3 years ago, to help spur physician residency programs in rural areas and give them the technical assistance to launch them. There have been more rural residency slots created in the last 3.5 years than in the prior 6 years, I think it was. So it really shows that intentional and federal investments in expanding that can really pay a dividend. We've talked a few times about this notion that having training in rural areas is more likely to keep you practicing in there subsequently. So there's a through line between those two that really directly connects that.
Good. Thanks for that. Anyone else want to comment on this, please? Yes,
One
please,
quick
Dr.
comment is that we built this healthcare system on the largest group of high school students and college students that ever went through in America, and that workforce is not available anymore. Unless we get a disproportionate share to go into healthcare, we will never be able to staff healthcare like we have before. So it'll require a lot of different innovations for us to not only treat people more efficiently and more effectively, but find ways to keep people well, to reduce the burden on the healthcare system, and more importantly, reduce their burden of illness.
Say that again, find ways to help people. Could you say that again? Keep them well. Go ahead, say that again. I'm a big believer in that. Go ahead. Just repeat it.
What I just said?
Yeah. Just the last part of what you said.
Yeah.
Great. It was a great truth.
That if in order for us to really meet the needs of the population has to be well. And making the investments up front to keep people healthy and to decrease the burden of their disease, decrease our need for healthcare providers, decreases the costs for healthcare, but most importantly, keeps people well. People don't want to be consumers of healthcare. People want to be well.
Where does obesity fit into that, if at all?
Obesity is huge. We've just done a study of our healthcare system, largely rural. When we look at the number of the patients that are hospitalized, more than 40% of the patients that are hospitalized at any given time in the 14 hospitals across our system have a diagnosis of diabetes. That may not be why they were admitted to the hospital, but the comorbidities associated with the diabetes are likely the thing that brought them in for hospital admission.
All right. Thank you very much. Thank you all very much. Great to see you.